again, our experience regarding this condition, COVID-19, and morbidity and mortality so far comes from the Wuhan and Chinese experience, and now from European experience.
Mm-hmm.
And what we have noticed is the factors which really affect the outcomes are certainly age and comorbidities like previous underlying health issues, diabetes, cardiovascular problems. Those are certainly very important to be noted. Uh, History of cancer, certainly, there was a recent publication in the Lancet Oncology from China. However, it's a very small cohort. I think 18 patients, cancer patients with COVID-19. So uh, the authors concluded that cancer definitely is uh, is a risk factor for a poor outcome. However, we need to confirm these small anecdotal findings. These
Yeah.
are not strong data. At present, I would advise caution to almost everybody with any sort of medical condition, especially cancer, diabetes, heart disease, chronic lung diseases like COPD,
Yeah.
etc. I think, and elderly, 60 and over. From our experience and from the literature right now, they are at added risk for developing complication. But COVID-19 is a great equalizer. We have seen patients, young and old,
Right.
healthy and debilitated, rich and poor. Everybody gets affected by this disease. The good news is most patients would recover.
Mm-hmm.
Okay, so that's one important thing I want to reassure our audience here. That most patients will recover, and they would only incur some minor symptoms. So it's really important for patients not develop panic, not be anxious, and do not stress is not helpful in this situation. Theoretically, yes, certain functional neuroendocrine tumor patients um, can get triggered, or their syndrome can get triggered with stress. It's a
Right.
well-known documented
Sure.
fact. And the stress is very personal, and yes, certainly we have seen in media patients with not even history of cancer. It has taken a lot of toll on a lot of people. We hear about these sad stories in the media, how stress is building up. It's not just from um, the COVID-19 and situation around us, but sometimes being at home without
Mm-hmm.
our friends and without socializing, which we are so
Yeah.
used to,
It's
can
depressing.
add to stress. And then on top of that, for our cancer patients, having the cancer diagnosis and they're already under so much stress because of the medications and the rigor of the treatments, etc. So stress can certainly be a huge factor. And my recommendation would be to everybody listening here, especially cancer patients, please try to avoid stress. It's not going to help. It's
For
only going
sure.
to hurt. And certainly in the certain nuance for NETs, like you mentioned, it can certainly theoretically cause a carcinoid carcinoma. Any stress can. Carcinoid syndrome, especially if it's an uncontrolled carcinoid syndrome, we know that these patients in general do worse as compared to somebody who don't have carcinoid syndrome or have well-controlled carcinoid syndrome, right?
Mm-hmm.
So that's a historical data. So that's why one of the key goals in the management of neuroendocrine tumors is to control the carcinoid syndrome, control the urinary 5-HIA to a point where patients don't develop these complications down the road. And um, but vis-a-vis COVID-19 in the short term, I do not foresee that an acute infectious condition like COVID-19 would confer any added risk to somebody with carcinoid syndrome, uh, controlled or uncontrolled. I think like it's a common theme. We've discussed this multiple times earlier today.
Yeah.
Anybody with chronic medical issues, health issues, they are they are at added disadvantage when dealing with COVID-19, age, etc. So those are the factors which have been well established for the time being. I don't think a carcinoid syndrome patient would be overtly at a higher risk than non-syndrome patient vis-a-vis COVID-19. Again, falling back to a general caveat that we don't really have granular data regarding COVID-19 infection risk and prior history of lung nets, or for that matter, lobectomies or
Hmm.
previous radiation history to the lung, etc. So with that caveat, I think certain things are very intuitive in our decision making right now. I would think that somebody with limited lung capacity because of lobectomy would be at added risk of complication
Hmm.
if they got infected with COVID-19. One of the you know one of the ways which COVID-19 affects us is by development of this bilateral pneumonia leading to what we call ARDS. Uh, Fortunately, ARDS doesn't happen to everybody,
Well,
right?
real quick, what does that stand for?
Acute respiratory distress syndrome.
Okay.
It's where the lungs and the alveoli of the lungs
Hmm.
get filled with this proteinaceous fluid,
Hmm.
and which hampers the oxygen exchange between air and the blood.
Okay.
And that's the reason why we need to support the patients admitted in ICU with the ventilator because of the ARDS. However, let me reassure the viewers here, most patients infected with COVID-19 will recover on their own, just like any other viral infection. In
Okay.
fact, 75% of patients would have just minor, mild symptoms, and they'll get better on their own. So I would like to reassure most patients. Now, there are 20 to 25% patients who might end up developing mild to moderate symptoms, which might need hospitalization.
Hmm.
And only 5% of patients might develop significant complications and might need ICU admission and ventilator support. So for most patients, they would get fever, sore throat, myalgias, minor symptoms, and they would overcome this and be fine. Now, I don't foresee why a lobectomy patient would have any added risk for developing COVID-19 infection. I think their risk would be probably similar to the general population.
Okay.
So they need to practice the guidelines for general population, which is social distancing, hand washing, trying to avoid sick contact. However, if they do tend to develop a COVID-19 infection, uh, then yes, potentially they they are high risk for developing complication. And this
Hmm.
is theoretical. I don't have data to support
Okay.
it. So Dipnic is quite a mouthful. Rain, I'll make you repeat this, okay? You ready for
Okay.
the
Yeah.
challenge?
Yeah. I'm ready.
So DIPNISH means diffuse idiopathic pulmonary neuroendocrine cell hyperplasia. It is a type of neuroendocrine tumor some people consider as a pre-neoplastic condition, which can lead to bronchial nets. Uh, and it is a type of lung net, I
Okay.
would say. And these patients often have asthma-like symptoms, so wheezing, shortness of breath, and chronic cough. Cough is definitely one of troublesome, symptoms with these patients. Um, Again, just as I mentioned, this is a very rare subset of neuroendocrine tumors. So certainly we do not have data regarding DIPNISH and added risk of COVID-19 complication. However, um, I would, theoretically, anybody with a compromised lung,
Hmm.
they are certainly at high risk for developing complications from COVID-19. Certain, not necessarily that they are high risk for developing COVID-19. Their risk for acquiring infection is similar to general population. However, if they do tend to develop COVID-19, then could they develop complications at a higher rate than a normal healthy person? Certainly possible. We don't have data for that. Also, DIPNISH, there are various, depends on what's the burden of DIPNISH and what
Okay.
has been done for that particular patient. If
Sure.
that patient underwent lobectomy and has compromised lung at baseline. So these are a lot of factors which would dictate the overall outcome and the risk stratification.